It is December 2025, and for the first time in a quarter century, the United States is standing on the edge of a public health cliff. Since the year 2000, we have lived in a country where measles was considered eliminated. It was a ghost of the past. But as of today, that status is under the most severe threat it has ever seen. With over 2,000 confirmed cases across 43 jurisdictions and the highest case counts since 1992, the clock is ticking. If we cannot stop sustained transmission by January 2026, the U.S. will officially lose its measles-free status. Today, we're looking at the data, the perfect storm of 2025, and why this is about much more than just a rash. Let's look at the scoreboard. As of late December, the CDC has documented over 2,012 confirmed cases. To put that in perspective, in all of 2024, we saw only 285. That is a 600% increase in a single year. We are seeing major hotspots in Texas with over 800 cases, Arizona, and South Carolina. But it's not just the number of cases, it's how they are spreading. Measles is the most contagious pathogen known to man. If one person has it, 9 out of 10 people close to them who are not immune will catch it. It's an airborne predator. It can linger in the air for up to 2 hours after an infected person has left the room. In 2025, we've seen outbreaks in schools, retail locations, and even LDS church wards in Utah, where wastewater testing is now being used to track the virus's silent spread through the community. Take South Carolina, specifically the upstate region. In just the last few weeks of December, their outbreak accelerated to 159 cases. Nearly all of them, 119 out of 126 in one sample, were completely unvaccinated. Health officials had to place over 300 people under quarantine just to slow the bleed. Meanwhile, in Utah, the virus has been detected in wastewater in Davis and Utah counties. This is a massive red flag. It means the virus is circulating far beyond the people showing up at clinics. It's the iceberg effect. For every confirmed case, there are likely dozens more we haven't caught yet. So, why is this happening now? It comes down to a single number: 95%. To keep measles at bay, a community needs a 95% vaccination rate for herd immunity. But in the 2024 to 2025 school year, national MMR coverage for kindergartners dropped to 92.5%. In some states like Idaho, it's as low as 78.5%. We are seeing the downstream effects of what experts call the communication void, with top health officials downplaying the threat of the disease and a surge in non-medical exemptions, which hit an all-time high of 3.4% this year. The firewall has collapsed. When the firewall drops below 95%, measles doesn't just trickle in, it rushes in. If the U.S. is downgraded in January 2026, the consequences are more than just symbolic. Canada already lost its status in November 2025. If the U.S. follows, we face 1. Economic strain. A single outbreak can cost local taxpayers millions in contact tracing and hospital resources. 2. Medical fallout. 11% of the 2025 cases required hospitalization. This isn't just a childhood rite of passage. It's pneumonia, brain swelling, encephalitis, and in 3 tragic cases this year, death. 3. Public health dominoes. When resources are drained to fight measles, we lose ground on maternal health, cancer screenings, and emergency preparedness. Conclusion: the January deadline. The next 30 days are critical. We are at a crossroads where the successes of the last 25 years meet the skepticism of the current moment. Whether we regain control or allow measles to become endemic once again depends entirely on the public's trust in evidence-based medicine. I'm your host for The Evidence Edge, and we will be tracking the January 2026 status report closely. Stay informed, stay safe, and look at the evidence.